My name is William McNary, and I'm the president of U.S. Action. I want to first of all give you greetings from our Ohio affiliate, Progress, Ohio. But at U.S. Action, we say there are three kinds of people. There are people that make things happen, there are people that watch things happen, and then there are people that don't know what's happening. I can't think of any place else in the world I would rather be on a Tuesday night than right here in Columbus, progressive, people who are not just content to spectate or speculate or postulate or pontificate about life, but people who are active participants in the movement for social justice and social change. I truly believe that you all are gathered here this evening, that people are going to live longer, people will have more healthcare choices, healthcare will be more affordable, people will all enjoy a higher quality of life because of the work that the citizens of Columbus have done, are doing, and most importantly, what y'all getting ready to do, and because we activists are often inundated and undercompensated and underappreciated and seldom celebrated, why don't y'all celebrate yourself right now? All the speakers, all the activists and advocates who spoke before me, let me thank you for challenging our heads with good information, challenging our hearts with good inspiration, and challenging our feet with good instruction. Having me speak at a rally like this is never a 50-50 proposition. I guarantee you, I've already received more wisdom and inspiration than I can give. So with that disclaimer, let me tell you, like Elizabeth Taylor told her last husband, I won't keep you long. Because today is your day. This is your moment. This is your moment to go to your congresspeople and your senators and speak out on behalf of the majority of Americans, the 3 out of 4 that want you to succeed. Today is your day for a breakthrough. So just like these speakers behind me, remind them that healthcare reform is not just underwriting statistics or numbers on an actuarial table or entries on a profit statement, or just another claim to review, adjust, and deny. These are real people. So go to your congresspeople and your senators and speak on behalf of the millions of uninsured, the underinsured, and the anxiously insured. Speak on behalf of those who are one union negotiation away from higher deductibles and copays. Speak on behalf of those who are one pink slip away from losing their coverage. Speak on behalf of those from one major illness away from bankruptcy, and speak on behalf of the insured who are paying more and more and getting less and less. And you tell them we need quality health care that is affordable and offered to all, and you tell them we need a choice of a public health insurance plan. To uphold real health care reform because they're doing very well, thank you. They're profiting very nicely under the current arrangement that puts profits before people. How many of you have heard of a guy named H. Edward Hanway? Raise your hand. Let me tell you who H. Edward Hanway is. He is the CEO of a giant Cigna insurance company. He made $12.2 million last year. That's $5,883 an hour. He made 30 times more than the CEO of the United States, President Barack Obama. He made more money in a day than the average working stiff makes all year long. And then when he retires, guess what? He's going to get a golden parachute worth another $73 million. And that's why the private insurance companies are fighting us so hard. Not because it will drive them out of business, but it will have to change the way that they do business. No longer will we be held at the mercy of the private insurance company, denying coverage if you have a pre-existing condition, raising your premiums if you get sick, keeping their mortgage, making ends meet. We need a choice of a public health insurance plan as a guaranteed backup for good benefits and a power. Lastly, all those congresspersons and senators who say this is something we can't do, this is a nice idea, but we can't afford it, or whatever their excuse, that's a lot easier for them to say. We pay them in Congress $174,000 a year. We pay for them to have full medical coverage. We pay for full dental coverage. We pay for full vision coverage. We pay for whole life coverage for Congress. We pay for long-term care, the ones who stay there long enough as a part of their congressional purpose. So if it's good enough for them, it's good enough for us. This is my last close. I was brought up back because I closed more than once. This is my final close. My brothers and sisters, this should not be about scoring political points. This is bigger than partisan politics. This is not just about Washington lobbyists and insiders. This is about you. This is about us. This is a fight that is going to determine who we are as a nation. And whether we reduce this battle to I got mine, you get yours, or whether we reaffirm a basic American ideal that yes, we are responsible for ourselves, but we're also responsible for each other. Yeah! I am my sister's people. This is our moment. We get ready to make history. It's surrounded by controversy, and truth is often the first casualty in a battle like this. You know, our opponents called Social Security the big government takeover when it was proposed in 1937. They called Medicare socialized medicine when it was proposed in 1964. And when Martin Luther King led the fight for freedom and equal rights, some people opposed him because they thought he was too radical. Others thought he was moving too fast. And I wasn't there when the freedom marches crossed the Edmund Pettus Bridge in Selma, Alabama, which led to civil rights and voting rights. But ask anybody who was there. Ask them who lived to talk about it. Their eyes will well up, and they'll speak of that moment with great pride. Well, I submit to you, my brothers and sisters, that this is one of those moments in history when our future generation, our children,